So Tanzania, the latest country to want to be part of buying this cure, inverted commas, from Madagascar. Well, we stick with issues Tanzanian, and concerns have been raised about Tanzania's response to COVID-19. Tanzanian President John Magufuli has opted not to impose stringent restrictions to mitigate the spread of the COVID-19 outbreak. Earlier this week, he suspended the head of the country's national laboratory services and cast doubt over the country's COVID-19 tally, which he blames on faulty test kits. Tanzania currently has 460 cases of COVID-19, with 16 deaths reported so far. Now, Zito Kabwe is the leader of the opposition party Alliance for Change and Transparency, and he joins us now via Skype. Thanks so much indeed for joining us. Welcome to the program.
Thank you so much. I'm here.
All right, so talk to us a little bit about how you view the way the government has been handling this COVID-19 pandemic in your country, led by the president.
First, Tanzanian government response is it started with a denying the existence of the pandemic, and then the response became a little bit lackluster, delusional. At times, leaders addressed the nation. For example, President Magufuli addressed the nation and said people can go to church, people can go to mosque. And later, 3 days of prayers were announced in the country. And then people have been allowed to continue their business as usual. And the president said he's not going to lock down Dar es Salaam, he's not going to lock down any city, while cases have been increasing. And as we are talking now, the government for the last 8 days, it hasn't informed the public about the number of cases or the number of deaths. And but the other part of Tanzania, Zanzibar, yesterday they released the new numbers, which have been increasing exponentially. And the situation is really not good. And Tanzania is now like a country that its response leaves others to wonder what kind of a response we are. And now you have seen, we have gone to Madagascar to collect the tonic.
All right, so you've said that the president is behaving like a man in denial, but to what end?
That is something most of us are wondering, because this is a global pandemic, but also it is very important to recognize this is not the first time this part of Africa is suffering from a pandemic. 100 years ago, we had the Spanish influenza, and more than 150,000 Tanzanians died then. And in some districts, every single household lost a loved one on that. So we have the historical evidence to learn from, but still we are in denial. And if you followed today, the chairman of the African Union, President Ramaphosa, was speaking with other leaders of Southern Africa and mentioned our president twice. Once, he advised that he calls the SABC summit to discuss about the pandemic online, and the president said, no, people can just write. And secondly, he did not attend the regional economic communities meeting with the African Union to address the pandemic. So it's like Tanzania is not the Tanzania that people used to know. We are putting aside science, and we started to put our lives to prayers, and now we are putting our lives to Madagascar.
Let's talk a little bit about his assertions that the testing process is not accurate. He said that he puts through animals, fruits and vehicle oil to be tested, and they came back positive. Is there some truth to that? I mean, is there some concerns about the efficacy of some of the testing?
First of all, scientists will be able to explain to this very well. because the tests are fabricated. They are made to make sure that only certain samples can get into and the results come out. So if the sample is from a human being, you can only be able to test organisms related to the human, and not the fruits or the oil, car oil or something like that. It is inconceivable, and no one has proven that something like that has been done. And our assumption, and for me especially, who believes in science, is that the president lied. He just said that. But it is very dangerous talk because it discredits the very lab system in the country. Because the citizens will no longer trust the lab tests. And this endangers not only Tanzania, it endangers the region. Because if other countries are taking measures in order to curb the spread of the virus. And if Tanzania doesn't, it means the virus will stay in Tanzania for a long time, and it will affect neighboring countries, the SABC region, South Africa inclusive, and the East African community and the whole continent. So that's why we think it is very important for the African Union, through the African CDC, Center for Disease Control, to intervene into Tanzania and tell President Magufuli that this is not your issue. This is a continental issue. This is a global pandemic. And the manner and ways and response on the pandemic should be on the standard given by the WHO, which is not the case now.
What response have you been getting from the president? I would imagine that you've tried to engage with him and his party in parliament as a starting point. What kind of response have you been getting from the president with regards these issues and the concerns that you have?
Our party wrote a letter to him on the 28th of March, suggesting 8 issues to be handled, including bringing the country together, handling the matter beyond the ideologies of political parties. And a week after, our chairperson of the party, Malim Seif Sharif Ahmad, addressed the nation, explaining to the people on the danger of the disease, measures to take, but also address the issue of the international community to be able to help through debt relief so that countries will have resources to fight the pandemic. And another 2 weeks after, our Secretary General of the party proposed to the government the measures to take on the lockdown, partial lockdown, supporting the people, the families which are suffering, because we know the impact and the effects of the lockdown. And we suggested how to support the people by providing them some grants, how to support the businesses, because our tourism sector has completely died, and the small businesses as well. There are a lot of job losses. 90,000 teachers from private schools have lost jobs because private schools cannot continue to pay their salaries. And all these suggestions, the government hasn't responded. The president addressed the nation last Sunday, telling people you should not appear. I'll bring to you medicine from Madagascar. The tests are not good. And just continue to go to the mosque and churches. There is no problem. And life is going on like that.
It seems that you're a country that's quite vulnerable at this time. Do you have enough resources, potential in terms of beds, hospitals, and backup plans, just in case this thing starts to surge in the numbers that we're seeing in other parts of the continent and the world?
Our health system is overwhelmed already. We have a number of medical doctors and frontline workers, like the doctors, nurses, and other healthcare workers who tested positive. Some of them are in quarantine. Around 120 healthcare workers from our national hospital, Muhimbili, in quarantine. They tested positive, and other parts of the country as well. So our health system is already overwhelmed, completely overwhelmed, and we don't have enough resources to handle that. That's why this issue should not be seen as a Tanzanian issue. It should be seen as a regional, as a continental, as global. And that's why we are leading in asking for the international community not only to intervene in Tanzania, to intervene, but also support through the debt relief, which is led by the effort led by President Ramaphosa.
All right, and perhaps finally, how are ordinary Tanzanians feeling when they hear opposition parties saying one thing and the president saying something else? I can only imagine it's confusing, but what else are they feeling?
It is. You are very right. It is confusing. When facing a pandemic like this, it is very important for all the political forces in the country to be together, to pull the same way as other countries have done. We saw in your country, the president and the leaders of the parties came together. And when the president was addressing the nation for the first time, all the leaders, all the political forces came together. Solidarity is very important. The head of the WHO is always telling us solidarity is very, very important. It is not the case in Tanzania. As we are speaking, the members of parliament from the opposition have boycotted parliament because 3 of our colleagues have died in mysterious circumstances. The government doesn't want to say that it's COVID-19, but the indication are clear that it's COVID-19. So the best way was for parliament to conduct its businesses online and not continuing to meet. But what has happened is the insults to the opposition, the leader of the opposition being insulted by the speaker and by the ruling party cadres and the like. So you are very right. It is confusing to the people, and this should stop because all of us should be pulling together in solidarity in order to fight the pandemic.
All right, so Mr. Kabwe, that's where we're going to have to leave it. Thanks very much indeed for joining us. Asante sana. That was Zito
Asante sana. Thank you so much.
Thank you. That was Zito Kabwe, the leader of the opposition party Alliance for Change and Transparency, Wazalendo.